Everybody share this broadcast on your Facebook page. I'm going to do an update on the coronavirus, what's been taking place. Basically the past 48 hours, we saw the Oval Office speech that Donald Trump gave 9 p.m. Eastern Standard Time on Wednesday, March 11th. This has a big reason why the stock market, the Dow Jones Industrial Average and other markets are tanking today. Okay. And we see that also a number of things have taken place. We saw the NBA suspend the rest of the season. The rest of the season, first one player tested positive for the Utah Jazz for the coronavirus. Then the second player, it was announced today, a second player has tested positive as well. Then you have the White House having to come out and correct a lot of some of the statements that Donald Trump made and some of the policy statements that Trump made in his Oval Office speech. The White House had to come out and correct that, so we'll deal with some of those corrections. We saw that Donald Trump announced a travel ban to many European countries, a travel ban from many European countries, people coming from European countries here. But it excluded 3 countries where Donald Trump has golf courses or resorts. So some people find that very strange, all right? We see the stock market tanking. We see that a number of conferences have been canceled because of this. Now, if you've been watching my broadcast, you know I've been saying for the past couple of weeks, this is going to get much worse. This is going to explode. This is going to have a huge impact on the economy. Okay? I told you all this stuff was going to happen. So we're going to do a recap of update you on what's been going on the past 48 hours or so, especially the past 24 hours. Democrats are trying to pass a bill in the House of Representatives to give relief and give aid to small businesses, give aid to people in general. We saw in the U.S. Senate on Wednesday, we saw one Republican, Senator Lamar Alexander, block the bill to give paid sick leave to a lot of American employees. All right. So when you have something like this take place, you have to ask the question, you know, especially these Republicans, where is their heart? Where is their compassion for people? Okay. And a lot of the people who are being harmed by this are people who voted for Republicans or voted for Donald Trump. All right, so let's look at I want to look at the updates from the Washington Post. They have live updates. We'll also look at some from NBCnews.com. I'm going to give you a lot of information, and then the Detroit Free Press had a really good article dealing with tips to stay healthy and tips to protect yourself from the coronavirus as well. So I'm going to give you that information also. Then African American business owners, post the name of your business here in the thread of the broadcast. Email us at customerservice@africanhistorynetwork.com. We'll let you know how you can advertise with the African History Network as well. Okay. All right. And if you like this type of information, you can donate $the AHN Show through Cash App, $the AHN Show through Cash App, or PayPal.me/the AHN Show through PayPal to the African History Network. All right. Okay. So let's jump into this here. And I hope everybody's staying healthy. Don't shake people's hands. Wash your hands thoroughly, at least 20 seconds. Even with elbow bumps, that's not good because people sneeze into their arm or cough into the crook of their arm. So even people are saying don't do elbow bumps either. All right, so let's look at the Washington Post. All right, so Wall Street suspended trading for a second time this week after the Standard & Poor's 500 plunged 7% just minutes into Thursday's session. It's reacting to Donald Trump's Oval Office speech and then the corrections that the White House has to come out and give. The New York Stock Exchange triggered the forced 15-minute trading halt known as a circuit breaker to stop the free fall and give traders time to recalibrate. The rarely used lever comes as the coronavirus's accelerating spread and worsening economic outlook have rattled global markets for weeks. The Dow Jones Industrial Average plummeted nearly 1,700 points at the open following Donald Trump's announcement that he would restrict all travel from Europe for 30 days to stem the spread of the pandemic. After the circuit breaker pause, the blue chip index briefly fell more than 1,900 points before rebounding slightly. Okay, at one point it was 2,200 points down. By mid-morning, it was down more than 1,800 points, or 7.6%. The S&P 500, Standard & Poor's 500, also saw a small bump after the break and was down 6.7% at mid-morning. The tech-heavy NASDAQ was down 6.5%. It's reacting to what's coming from the White House, the policies coming from the White House, what Trump is saying, the uncertainty, the mixed messages coming from the White House. I sat and watched live what the Trump's Oval Office address. You saw some of my Facebook comments, especially ones on my personal page. Okay, I ain't post all the ones on our fan page on my personal page. Okay, just 2 weeks ago, he told people, when he was on Fox News on Sean Hannity's show, he told people it was basically okay to go to work sick with the coronavirus. He told, if you look at the article from NBCnews.com, Trump has many hunches about the coronavirus. Here's what the experts say. Okay, this is from either March 6th or March 7th, 2020. On page 4, Trump says it's okay to go to work when sick. Experts say do not go to work. In the Fox News interview with Sean Hannity, Trump, and let me pull it up here. We have it here. Yeah, Trump has many hunches, okay? His hunches aren't worth any good. I'm going to give you the link to this article. Read this. Trump suggested that people infected with the virus could still go to work and make full recoveries. This is in direct contrast to what the CDC, Center for Disease Control and Prevention, has advised people to do. Donald Trump being interviewed by Sean Hannity on Fox News. Now, if you understand the Fox News network, their viewership skews older white males, especially 50 years old, 60 years old, 70 years old. This is who watches Fox News. Donald Trump said if we have thousands or hundreds of thousands of people that get better just by, sitting around and even going to work, some of them go to work, but they get better. This is what he said. The Center for Disease Control has said people displaying symptoms should stay home and self-quarantine unless they are seeking medical care. Quote, people who are mildly ill with COVID-19 are able to isolate at home during their illness. You should restrict activities outside your home except for getting medical care. Do not go to work. This is from the CDC's website. They're telling you don't go to work. Don't go to work, school, or public areas. Avoid using public transportation, ride sharing, Uber, Lyft, things like this, or taxis. This is from the CDC's website. This was in direct contradiction to what Trump told Sean Hannity almost 2 weeks ago. But then in his Oval Office address, he's contradicting what he told Sean Hannity. Read this article here, because it goes through and breaks down how the lies Trump has been saying. We just saw Dr. Anthony Fauci, who is the director of the National Institute of Health and Allergies. He testified in front of Congress on Wednesday, March 11th, and he talked about how the coronavirus is 10 times as lethal as the flu. So you have people like Rush Limbaugh, who got the Presidential Medal of Freedom. You have people like Donald Trump. Donald Trump told Sean Hannity in an interview on Fox News, Trump says coronavirus is like a flu. Experts say it's multiple times worse. Trump has repeatedly conflated the coronavirus with the seasonal flu, downplaying the severity of the new virus. In the Sean Hannity interview, Trump referred to the virus as corona flu. And during a news conference last week, he claimed that coronavirus is like a flu. Many experts have cautioned that the coronavirus is different from influenza, especially because no vaccine is available for the coronavirus. Now, some of the symptoms are similar, but it's different, it's more contagious, and as Dr. Anthony Fauci testified in front of Congress yesterday, is at least 10 times as lethal. It's at least 10 times as lethal. So far, the coronavirus appears to be more contagious and more deadly than the flu. This is an example of how elections have consequences. This is what happens when you have somebody who is mentally unstable, incompetent, doesn't want to listen to the experts, think they know more than the experts. Okay? Putting out misinformation to people. It causes confusion. It causes panic. It jeopardizes people's lives. Okay, so let's continue with the live updates. Let me give you this article also here from NBCnews.com because I got a ton of information on this. Okay, but I'm just giving you. Well, I'm going to give you a portion of this here. All right, how's everybody doing? I know some people are home from work, kids are out of school, things like this. This is another thing. This is why Congress is trying to get this bill passed. Democrats in the House of Representatives are trying to get this bill passed because with schools being closed, a lot of schools being closed, elementary schools, etc. For some children, that's the only meal they get a day at school. Okay, so the pneumonia-like illness, coronavirus, COVID-19, the pneumonia-like illness has spread to every continent except Antarctica since it first emerged in China last year, okay, in 2019, sickening more than 120,000 people worldwide and claiming thousands of lives. So the death toll is over 3,000 worldwide now. It's well over 3,000. The United States has more than 1,000 confirmed cases. It's close to about 1,300 or maybe a little over 1,300 confirmed cases as of now and more than 30 deaths, okay? You have 1 million test kits that have basically hit facilities, hit the health facilities, things like this. And probably by the end of the week or maybe early next week, 4 million test kits would have arrived at the health facilities. As the test kits arrive, more people can be tested. You'll see the numbers of reported cases skyrocket. Now, it's good that you can test, and it's good that people can test and be diagnosed with it. And if they're tested early enough, it reduces the severity of it, and it reduces how many people they contaminated with it as well, potentially. Now, the White House and Congress are at odds. The White House and Congress are at odds over the type of economic rescue package to assemble. The Trump administration has pushed the ideal of new tax cuts and delayed tax filings as a way to boost the economy, as well as expanding sick leave benefits and helping the airline, hotel, and cruise industries. Democrats are moving ahead in the House of Representatives with a plan to expand unemployment insurance, provide more sick leave, and assure food benefits are available for people who lose their jobs and need emergency assistance. The Trump administration is focused on big business, largely. They're focused on the airlines. They're focused on the travel industry. They're focused on business and trying to prop up the stock market. Democrats in the House of Representatives largely are focused on the everyday people and how this is going to impact the everyday people. That's why in their bill, and Nancy Pelosi did a press conference today talking about their bill they're trying to get passed in the House of Representatives that is going to benefit everyday people. They're focused on expanding employment insurance, provide more sick leave, and assure food benefits are available for people who lose their jobs and need emergency assistance. Now, Ed Yardeni is president of Yardeni Research, who wrote a commentary on Thursday, March 12th, and said the bad news for the travel, entertainment, leisure, and energy industries resulting from the virus fears, initial unemployment claims are likely to move higher soon. Measures of consumer and business confidence are likely to drop sharply soon as well. A recession is not inevitable, but it certainly is becoming more likely, end quote. Yeah, I agree with that. All right. Now, We saw that Norwegian Cruise Line, let's see, we saw that one of the cruise lines canceled, they're canceling cruises. I think it was Princess. I'll verify that for you. We'll look that up because I get news alerts all throughout the day. But one of the major cruise lines is canceling cruises. And as I said before, I've been on cruises before. You can give me a free cruise right now. Yeah, Princess Cruise Line. Washington Post reported that Princess Cruises cancels all sailings for 2 months. The cruise operator, which has faced quarantines on 2 coronavirus-stricken ships, announced it would, quote, voluntarily pause global operations of its 18 vessels from Thursday through Thursday, March 12th through May 10th. Okay, so let's look at. I want to give you some more of these updates. Airline stocks sink as carriers cut flights and earnings outlooks amid catering demand. So this is hitting the hotel industry. This is hitting the travel industry all throughout the hotel industry, restaurants, airlines. When you go to the airport, all the stores, the retail stores that are there in the airports, they're suffering as well. America's major domestic air carrier stocks have tumbled this week as the airlines cut capacity, axe routes, get rid of routes, trim financial outlooks, and slash executive pay amid bottoming demand from the coronavirus. The tourism industry has been among the hardest hit by the coronavirus. In a matter of weeks, hotels, airlines, and convention centers have seen their bookings plummet as leisure travelers stay home and businesses discourage or cancel employee travel. Okay, I'm supposed to be speaking in Baltimore at the end of this month, trying to figure out if that's going to happen. We just saw the National Business League had to cancel their big event dealing with economic empowerment that was supposed to take place today. They had to postpone that. Okay, we see across the country, Coachella has been postponed. We see the NBA suspended the rest of the season. Also, MLS, Major League Soccer. Major League Soccer announced today that they're suspending the rest of the season until further notice. All right, this is having a huge ripple effect throughout the economy. Now, so the tourism industry has been among the hardest hit by the coronavirus. In a matter of weeks, hotels, airlines, and convention centers have seen their bookings plummet as leisure travelers stay home and businesses discourage or cancel employee travel. And the latest updates from Delta Airlines, American Airlines, and United Airlines signal that their outlook for the coming months is equally bleak as travelers cancel vacations, businesses discourage employees from leaving town, and conventions are canceled en masse. Industry executives are comparing the outbreak's fear factor to the aftermath of September 11, 2001 terrorist attack, 9/11. Okay, so you have African Americans that have businesses in these various industries. I know African Americans who are travel agents. Okay, those that own restaurants. You have some that own hotels. All of this, they're negatively impacted. This is a perfect example. This is a textbook case of how politics impacts business. So you got some people who say, oh, we should just focus on economic empowerment and business and all this stuff and invest in the stock market, things like that. All that's good. That's fine. I'm all for that. But you also have to understand how politics is the legal distribution of scarce wealth, power, and resources, the writing of laws, statutes, ordinances, amendments, and treaties, their adoption, interpretation, and enforcement. And you have to understand how government policies, how laws, things like this, how they impact and help create the environment that your business operates within. This is an example of this. This is an example of what happens when you have somebody who is a con man, who is totally incompetent, who sends mixed messages, who does not understand science, who puts out misinformation that causes confusion, who's sitting there reading from a teleprompter, reading his own policies and still gets it wrong. This is an example of that. So you have to have both. You have to have the business, you have to have the entrepreneurship, the economics, and you have to have the politics. And if we want to be honest with you, the businesses operate based upon government regulations, whether it's city government, county, state, federal government. So we have to understand how this intersects. Now, Delta Airlines stock was down more than 13.5% in early trading. The Atlanta-based carrier cutting international flights by as much as 25% and domestic routes as much as 15%. Okay, so you're going to have people who work less hours, people who are flight attendants, those at customer service work less hours. You're going to have less traffic coming through the airports. You're going to have less people getting taxi rides and Uber rides to and from. Those who there are approximately 6 million people who work in the what's called the gig economy. Okay, Uber Eats, Grubhub, Lyft. Uber. A lot of them are African Americans. They're going to be affected by this. This impacts their ability to pay rent, pay their mortgage, take care of the responsibilities, help their children out. And if we want to be quite honest with this, right? Probably about half the millennials are living at home with their parents or their grandparents, or they're financially dependent on parents or grandparents. Probably about half the millennials or so. If you're a millennial and it's not you, you probably know 10 millennials that applies to. So this is an example of how elections have consequences. This is an example of how politics impacts your economic condition. So the Delta Airlines stock was down more than 13.5% in early trading. The Atlanta-based carrier cutting international flights by as much as 25% and domestic routes as much as 15%. The carrier also is withdrawing its 2020 financial outlook. The carrier is also drawing its 2020 financial outlook, instituting a hiring freeze and suspending its stock repurchase program. So all this is impacting stocks. All this is impacting the financial markets. All this is impacting business, corporations. If Delta Airlines is doing this and they're a multi-billion-dollar corporation, what do you think small African-American owned businesses will go through? American Airlines was down nearly 7% in early trading. The Fort Worth, Dallas-based carrier is less vulnerable to declines in international business, but will scale back peak summer international flying by 10%, including a 55% reduction in trans-Pacific routes as the outbreak continues to exact a toll on China, South Korea, and Japan. American Airlines will also reduce domestic flying in April by 7.5%. United Airlines, which has seen a 70% plunge in domestic net bookings, was down nearly 16.5% in early trading. The Chicago-based carrier said Tuesday that its CEO and president will forego their base salaries through at least the end of June, and that it plans to cut 20% of flights indefinitely until it sees demand pick up. Now, this is what white businesses are going through. You got a CEO foregoing their base salary. So we see the S&P 500 could slide into a bear market today as well. The Standard & Poor's 500, S&P 500 has not yet entered a bear market, but the broad index has lost $5.3 trillion in value amid recent volatility and is down 19% from its February high. S&P 500 futures are calling for losses of more than 125 points or 4.7% at open. Now, we saw Trump. So Trump meets Wall Street leaders as U.S. markets experience a historic slide. Trump is focusing on big business and Wall Street, but not focusing on Main Street and the everyday person. And this is part of the problem. Okay, so I'm scrolling down here. Let's get some of these other updates. Okay. And let's refresh that here. All right, now let's look at the we'll go to the NBA season being canceled. The NBA season being canceled got a whole lot of black people's attention. They thought it was a hoax. They thought black people couldn't get the coronavirus. Okay, you got two of them now to have it. Okay, that got a whole lot. That got a whole lot of African Americans' attention. Um, let's look at the NBA. So, a second Utah Jazz player has been diagnosed with the coronavirus. WDIV, Channel 4 in Detroit is reporting this. Other news outlets are reporting this as well. Um, the first player was Rudy Gobert, and a second player on the Utah Jazz has tested positive for coronavirus after Rudy Gobert, who tested positive days after mocking the virus and touching all the microphones at a press conference, was quote unquote careless and touching others in the locker room, according to ESPN. So other players were saying that Rudy Gobert, who is the first Utah Jazz player diagnosed with the coronavirus, just days before he was diagnosed, mocked the virus and was said to be careless and touching all the microphones at a press conference. Now, NBA insider Adrian Wojnarowski tweeted that the Utah Jazz star Donovan Mitchell is the second NBA player to test positive for the coronavirus. Rudy Gobert became the league's patient zero on Wednesday evening, and his positive test led to the league suspending the rest of the season within minutes. Okay, so if we look at now, let's continue this article here, and then we're going to go to reporting from NBCNews.com that reported from March 11th that reported the suspension of the rest of the NBA season. Now, a video emerged Wednesday, March 11th, Wednesday evening, that showed Rudy Gobert mocking the coronavirus during a press conference. He made a show of standing up without touching anything before turning back around and rubbing all the microphones and jogging out of the room. He became the league's first positive test just days later. Okay, so I hope he has a full recovery. He probably will. He's healthy. He's young, right? But what happens is you can be contagious. You can be asymptomatic, which means you don't have symptoms, but you're infected with it and you're contagious. So you can infect other people who are elderly, who have a compromised immune system. And it can be much more devastating for them than for you. Okay, so if we go to the reporting from NBCNews.com, let's see. They announced the cancellation. They announced the suspension of the NBA season. Let me pull up that article here. I have about 50 tabs open, so just bear with me. Okay. NBA suspends a remainder of season. NBA suspends all games as coronavirus spreads. So we saw that the NBA suspended all games starting Thursday after a player for the Utah Jazz preliminarily tested positive for COVID-19. The league said play would be suspended until further notice. The test result was reportedly shortly before tip-off of Wednesday night's game between the Utah Jazz and Oklahoma City Thunder in Oklahoma City. So we know Rudy Gobert was the affected player. You know, that's kind of like Matt Gaetz, Representative Matt Gaetz of Florida, who when on the House floor, when they were trying to pass the $8.3 billion bill to fund aid for the coronavirus and research and things like this, he's sitting there on the House of Representatives floor with a gas mask on, okay, mocking the coronavirus. And then a couple days after that or so, one of his constituents in his district dies of the coronavirus. And he's forced to then act like a decent human being and to put out a statement of his condolences and things like this. And then we find out that at the CPAC conference a couple weeks ago, he came in contact with someone who has been diagnosed with the coronavirus. So then he had to self-quarantine himself for 14 days. I said, you know, in many ways, this is the chickens coming home to roost right here. when you declare war on science, you sit here and mock a catastrophe like this, and all this stuff is coming back on you. Okay. All right. So let's go to. I want to go to the statements that Trump made last night. In the statements that the White House had to come out and correct and say, no, this is not what he meant. This is not what he said. This is wrong. Okay. Let's go to that here, and I'm going to pull up the. Also want to pull up the live updates from NBC News as well. How's everybody doing? Okay, everybody staying safe. You washing your hands, hopefully. Don't shake people's hands. I know some of y'all. How many of y'all are working from home today? Okay, so YahooNews.com has a good article dealing with the White House scrambles to clarify key details from Donald Trump's speech announcing his coronavirus response. He's sitting there reading his own policies from a teleprompter, and he still got it wrong. Okay, you can't make this stuff up. 3 crucial components of Donald Trump's nationally televised Wednesday night address on the U.S. response to the novel coronavirus were quickly walked back or contradicted after Trump announced a 30-day ban on travel from most of Europe to the U.S. The Department of Homeland Security clarified that it would exclude U.S. citizens and permanent residents. Okay, meaning if you are a U.S. citizen and you travel abroad. Okay, because this ban is supposed to go into effect Friday at midnight. So if you are scheduled, if you're a U.S. citizen and you traveled abroad, say you went to Paris, and you're scheduled to come back from Paris in 2 weeks, people hearing this and say, "Oh, well, I can't come back home now, unless I get back before Friday midnight." Okay, so he's sitting there reading his own policies from a teleprompter, and he still gets the stuff wrong. Trump also issued a tweet saying that trade of goods between the U.S. and Europe would not be halted after saying the opposite in his speech. In his speech, he said the trade of goods between the U.S. and Europe would be halted. He had to go on Twitter and correct that. Also, a major U.S. health insurance industry group contradicted Trump's claim that major health insurers would waive co-payments on coronavirus treatments. Clarifying the waivers would apply to testing. He said that they would waive co-payments for coronavirus treatments. No, it's the cost of the testing, the co-payments for the testing, that would be waived. Those are 2 different things. So minutes after Donald Trump delivered a major address Wednesday night on the U.S. response to the novel coronavirus, his own administration and other U.S. officials publicly contradicted 3 important claims from his speech, okay, that I just went through. Now, the outbreak of the new coronavirus, first identified in China, has now spread to 118 countries and regions, infecting at least 126,000 people worldwide and causing more than 4,600 deaths worldwide. Okay, that's the number. I have to look at the New York Times has a world map that shows you all the countries, and it shows you how many reported cases in the countries, and it shows you how many deaths as well. On Wednesday, the World Health Organization, the World Health Organization, officially declared the coronavirus a pandemic or a global pandemic. Now, there are now more than 1,300 confirmed cases and at least 38 deaths from the coronavirus in the U.S. The cases are spreading throughout Washington, throughout the state of Washington, throughout the District of Washington, D.C., and 38 states, many of which have made emergency declarations. So when they're shutting down schools and things like this, like we're going through this right now in Michigan, okay? They're not panicking What it is they're trying to get ahead of this and keep it from getting much worse. The reason why is because if you saw the Rachel Maddow show last night, if you read the op-ed article from Tom Bossert headed up a department in the Trump administration, and I forgot exactly which one it was, but Tom Bossert a few days ago said that we are basically 10 days away from the hospitals getting creamed, meaning that the hospitals being overran with people who are trying to get tested for the coronavirus or who have it, because you already have a certain number of hospital beds that are already occupied. There are only about 1 million hospital beds in the country, okay? And I'm going to try to pull this up here because I saved the, it was an update from, I looked at the op-ed he did for Washington Post, and then also the NBC News picked it up as well. Okay, but what happens is you only have a certain number of hospital beds. A lot of them are already you have about they service about something like 35 million people in a year. If you have a run on hospitals because of this, they won't be able to support the capacity. They won't be able to support the demand. And what's taking place is when you have to self-quarantine, when you've been diagnosed with this and you have to self-quarantine, if you live by yourself, okay, that's not a big problem. But if you live with other people, you're married, you have children, okay, now you trying to self-quarantine could be a big problem. So your family may be able to go stay with relatives for 1 week and go stay with other relatives for the other week. But then those relatives may say, well, wait a second. He's contagious or she's contagious before it was diagnosed. So you may have it and you may bring it to my house. Okay? Or you may go stay at a hotel if you can afford a hotel for 2 weeks. But if you can't do all that, you may have to go stay at the hospital to be self-quarantined, which causes a run on hospital beds. So this is why a lot of states are taking these precautions and canceling events, etc., and closing down some schools where maybe they have a reported case or what have you, to get ahead of this, to reduce, to really slow down the spread of this, okay? So there's not a run on the hospitals. All right, I'm trying to find that one. We'll pull that up. Information from the statement from Tom Bossert. I'll pull that up. Okay, but let's continue here. Once again, this is an example of how elections have consequences. This is how understanding how politics impacts every aspect of your life. This is an example of what happens when you have somebody incompetent who's in charge of the government, who's in charge, who's governing over 329 million people. Okay, so the U.S. has been relatively slow to respond to the coronavirus compared with other nations, testing far fewer people per capita for the coronavirus and dispatching fewer coordinated resources to combat its spread, as Donald Trump has publicly downplayed its severity. Here are the important claims about the U.S. coronavirus response from Trump's speech that were later clarified or walked back. So, the Department of Homeland Security issued a major clarification to Trump's travel ban announcement. In his speech, Donald Trump announced that the United States would take the drastic step of banning all travel from most of Europe for 30 days to limit the spread of the coronavirus abroad. Okay. Shortly after his speech, however, the Department of Homeland Security issued major clarifications to remarks announcing that the travel ban would not apply to U.S. citizens or permanent residents abroad. The update also made clear the specific countries affected, listing the 26 members of the Schengen area, Schengen, Schengen, Schengen area travel agreement that covers most of mainland Europe, but excludes the UK and Ireland. It excludes the UK and Ireland. Trump had not mentioned Ireland's exemption in his announcement, prompting Dublin Airport to make clear that it was not part of the new ban. Okay, Trump himself walked back to his remarks on halting trade with Europe, so I talked about that as well. And then a powerful insurance lobby contradicted Trump's comment on insurance waivers. Now, also, you had European, was it the European Union that came out and said that, wait a second, man, you didn't consult with us. Yeah, coronavirus. European Union blasts Trump's travel ban as it unleashes chaos and confusion. The European Union disapproves of the fact that the United States' decision to impose a travel ban was taken unilaterally and without consultation. They're saying, well, you ain't talked to us about this before you imposed this travel ban. Once again, this is incompetence. Okay, let me give you the link here to this article. All right. Okay, how you doing, Shaquila, Emily, Keela? Okay. All right, everybody be sure to follow us on our Facebook fan page, The African History Network, The African History Network, and my YouTube channel, Michael Imhotep, IMHOTEP on YouTube also. Turn on the notifications so you know when we go live. All right, I want to, so Mike Pence, VP Mike Pence was interviewed Thursday morning on NBC, the Today Show. Mike Pence says there's been irresponsible rhetoric from people downplaying coronavirus. Donald Trump just this past Monday said that the fake news media and their partner, the Democratic Party, is Democratic Party, not Democrat Party, dumbass. Trump said Monday that the fake news media and their partner, the Democrat Party, is doing everything to inflame the coronavirus situation. VP Mike Pence said Thursday morning, he was interviewed on the Today Show, that there has been irresponsible rhetoric from people who have downplayed the seriousness of the U.S. coronavirus outbreak. In an interview on the Today Show, Savannah Guthrie asked what message Pence sends to people who are not afraid of the coronavirus and think it's just politics and hype, quoting from President Donald Trump, who said on Monday that the fake news media and their partner, the Democrat Party, is doing everything to inflame the coronavirus situation. Mike Pence said, quote, there's been some irresponsible rhetoric, but the American people should know President Trump has no higher priority than the health and safety and well-being of the people of this country. I think he's more concerned about keeping the stock market up myself, to tell you the truth. Okay, so, and we know that Mike Pence heads up the President Coronavirus Task Force and said that the administration will focus on communities that experience community spread of the virus, and said Trump's action on Wednesday night suspending travel from Europe to the U.S. is one more example of how he's putting the health of America first. Okay, but as Joe Scarborough talked about this morning on Morning Joe, the killer's already in the house. One of the biggest problems is a lack of actual testing. And this came from Trump waging war on scientists for the past 2 years. So for instance, if you look at BusinessInsider.com, February 25th, 2020, Trump spent the past 2 years slashing the government agencies responsible for handling the coronavirus outbreak. If we look at foreignpolicy.com, okay, you've heard me talk about this article from Foreign Policy, and this also talks about Tom Bossert, okay. In May of 2018, Trump, so the name of this article from foreignpolicy.com, we'll post a link here. Trump has sabotaged America's coronavirus response. Trump has sabotaged America's coronavirus response as it improvises its way through a public health crisis. The United States has never been less prepared for a pandemic. In May of 2018, Donald Trump ordered the National Security Council's entire global health security unit shut down. The entire global health security unit shut down, calling for reassignment of Rear Admiral Timothy Zimmer and dissolution of his team inside the agency. The team, the months before, hold on a second, I lost my place here. Okay, the month before, then White House National Security Advisor John Bolton pressured Rear Admiral Timothy Zimmer's Department of Homeland Security counterpart, Tom Bossert, to resign along with his team. Neither the National Security Council nor the Department of Homeland Security epidemic teams have been replaced. The Global Health section of the Center for Disease Control and Prevention, the Global Health section of the Center for Disease Control and Prevention was so drastically cut in 2018 that much of its staff was laid off, and the number of countries it was working in was reduced from 49 countries to just 10 countries. One of the countries that they stopped working in was China. Meanwhile, throughout 2018, the U.S. Agency for International Development and its director, Mark Green, came repeatedly under fire from both the White House and Secretary of State Mike Pompeo. And though Congress has so far managed to block the Trump administration plans to cut the U.S. Public Health Service Commission Corps by 40%, because this is what the Trump administration wants to do, the disease-fighting cadres have steadily eroded as retiring officers go unreplaced. So you have retiring scientists, officers, things like this. They retire, they're not being replaced. So you have a hollowing out of the scientists and the experts who would be able to foresee something like the coronavirus coming and be able to head it off, reduce the severity of it. So read this full article here from foreignpolicy.com. Okay, now I want to go to, I have a few more updates to give you here because there's so much going on. Let's go to, I want to pull up the comment from Tom Bossert because that's important. Just a second here. I thought I had it in. Okay, I have to find it. Just a minute here. I want to Google this. Okay, if we look at the reporting from NBC News, we are 10 days away from the hospitals getting creamed. We are 10 days away from the hospitals getting creamed, warned former Homeland Security advisor. The U.S., so this is from would be Tuesday, March 10th. The U.S. is a little more than a week away from a healthcare crisis related to the new coronavirus, according to the man who once advised Donald Trump on how to respond to pandemics. This is what Tom Bossert did. Tom Bossert said we are 10 days away from the hospitals getting creamed. He was Trump's Homeland Security advisor until he was ousted in 2018. Tom Bossert was never replaced, and Trump eliminated the National Security Council jobs related to disease outbreaks. In an op-ed article in the Washington Post published on Monday, that'll be Monday, March 9th, Tom Bossert said that unless the U.S. closes schools, halts public gatherings, and takes other steps to reduce community transmission, the country is headed for the sort of crisis Italy is now facing. Italy has a complete shutdown. 60 million people. They have a complete lockdown on Italy, unless you're going to get medicine or something like that. The country is headed for the sort of crisis Italy is now facing, with hospitals overwhelmed by elderly people in need of critical care. Tom Bossert said, simply put, as evidence of human-to-human transmission becomes clear in a community, officials must pull the trigger on aggressive interventions. Time matters. 2 weeks of delay can mean the difference between success and failure. Public health experts learned this in 1918 when the Spanish flu killed 50 million people worldwide. 50 to 100 million people worldwide. Most of the reporting I see is 50 million people worldwide were killed by the Spanish flu pandemic of 1918. 675,000 people in the U.S. died. One of the people that died from it was Donald Trump's grandfather. Washington Post has an article about that. Donald Trump's grandfather died from the Spanish flu. And the Washington Post has another good article that deals with how Donald Trump has not learned the lesson of the 1918 Spanish flu pandemic. We'll talk about that on my Sunday night show. We'll be on Sunday 9 p.m. 11 p.m. Eastern Standard Time, the African History Network show. Okay, and we'll talk about that. But that article, yeah, Trump is ignoring the lessons of the 1918 flu pandemic that killed millions, historians say. And this is why understanding history is so important, because history doesn't just tell us about our successes in the past, it also tells us about our failures. You know, those that don't know history are destined to repeat it. So when you can study how do we deal with pandemics like this in the past, right? You can learn from those mistakes, learn from the successes, implement them to help you today. But when you're ignorant of history, when you're governing over 329 people, you're ignorant of history. You think climate change is a hoax. You think you know more than the scientists. You declare war on the scientists. This is an example of what happens. So public health experts learned this in 1918 when the Spanish flu killed 50 million people to 100 million people around the globe. If we fail to take action, we will watch our healthcare system be overwhelmed. Okay, so I'm going to give you the link here. They have the update from NBC News, and then also it has the link to the article. How you doing, Anita and Wayne? This is the link to the article from Washington Post. But the article, the op-ed that Tom Bossert wrote for the Washington Post is entitled, "It's Now or Never for the U.S. if it hopes to keep coronavirus from burning out of control." It's now or never. It's now or never for the U.S. if it hopes to keep coronavirus from burning out of control. The first phase of the coronavirus outbreak was a domestic challenge for China and a border containment one for the United States and others. Now we are in the second phase, community mitigation. Math and history must guide our next steps. This is what he's saying. You have to understand math and history. The near-term objective should be to reduce the acute exponential growth of the outbreak in order to reduce suffering and the strain on our healthcare system. That will require significant effort, but it can work, as we have seen. Hong Kong and Singapore have achieved linear growth of COVID-19 cases, staving off the terrifying exponential upward curve confronting Italy and pushing both the infection rate down and new cases out on the timeline. The United States needs to take note. The virus is such a threat because it is both highly infectious and lethal, and not enough people are being tested despite significant recent effort by the Center for Disease Control and Prevention. By the time cases are confirmed, significant community transmission has likely already occurred. This is a classic tip of the iceberg phenomenon. It's also akin to looking at a star. The light we see today was emitted some time ago, because the stars are light years away. But the most useful comparison now is to fire a fire that threatens to burn out of control. It is one we can still contain, even extinguish if we act. The best way to put out the fire is a vaccine, but that is over a year away. In the meantime, we must focus on reducing the height of the outbreak curve. This requires coordination and implementation of non-pharmaceutical interventions, school closures, isolation of the sick, home quarantines of those who have come into contact with the sick, social distancing, telework or telecommuting, working from home, on the laptop, through the internet, and large gathering cancellations must be implemented before the spread of the disease in any community reaches 1%. After that, science tells us these interventions become far less effective. Okay, read the rest of this here. This is a warning. All right, this is from Tom Bossert, who wrote this op-ed for the Washington Post. This came out March 9th, 2020. Okay, so we'll post this link here for you. All right, Lonnie, how you doing? Lonnie, SB in Seattle. We know how y'all doing in Seattle, because we know Seattle's been hard hit. Governor Jay Inslee declared a state of emergency. That was, I think, probably the first state to declare a state of emergency was the state of Washington. We know there have been a number of deaths. The state of Washington, I think, is the state that has the most number of deaths also behind the coronavirus. And this dumbass Donald Trump, when he was at the Center for Disease Control and Prevention last Friday in Atlanta, he said he told Mike Pence, don't compliment Governor Jay Inslee, don't praise him. He called Governor Jay Inslee of the state of Washington a snake. Governor Jay Inslee is trying to contain this. He's dealing with deaths. He's dealing with a nursing home where it's spreading through, at least one nursing home where it's spreading through, and you got the President of the United States calling Governor Jay Inslee a snake. Just ridiculous. All right, let's see here. I think, okay, I want to go to the article from the Free Press that deals with trying to protect yourself from the coronavirus. Okay, I want to look and see if there's any more quick updates I want to give you. We'll do a refresh here. How's everybody doing? Those just joining us. I'm Michael Imhotep, founder of the African History Network, host of the African History Network show. I'm a talk show host, researcher, lecturer, writer, historian. We're doing some updates here on what's going on with the coronavirus as it spreads, as the stock market continues to tank. We saw the stock market go into a bear market on Wednesday, March 11th, ending a 11-year bull run. We see the World Health Organization declaring a global pandemic. We see airlines canceling flights and cutting back on flight schedules. We see the NBA suspended the season indefinitely, the rest of the season indefinitely. Okay, so let me just look. I had some articles marked. Let's just look at this quickly here. Make sure I give you all this. Huffington Post has the article, Top Disease Expert Repeatedly Checks People Comparing Coronavirus to the Flu. This is very important. So you have all these people like dumbass Donald Trump who say, oh, it's just like the flu, blah, blah, blah. And Trump was even in a meeting with the health experts and Dr. Anthony Fauci. And he asked the question, why can't you just use the flu vaccine for the coronavirus? MSN.com, you've heard me talk about this before. This is from, I think, March 4th, 2020. Experts baffled as Trump asked why they can't just use flu vaccines to prevent coronavirus. Experts baffled as Trump asks why they can't just use the flu vaccines to prevent coronavirus. And the experts are sitting there looking at him, trying to figure out, how to explain this to him so that he really understands. Okay, so the nation's leading infectious diseases expert, Dr. Anthony Fauci, has urged Americans to take the coronavirus outbreak very seriously, repeatedly setting people straight for suggesting COVID-19 is less lethal than the seasonal flu. Okay, and let's see. So also we know that the Joe Biden and Bernie Sanders canceled rallies. We know they canceled rallies in Cleveland. Okay, and then let's see, we get this news story also. Democrats moved Sunday Biden-Sanders debate from Phoenix to D.C. amid coronavirus concerns. Okay, so yeah, see, this is having a wide ranging impact. We know, and we also know for the at least for the one in Arizona, Phoenix, they were not going to have an audience. I don't think they're going to have an audience also for when they move it to D.C. as well. This shift comes after the DNC, the Democratic National Committee, and CNN, the debate host, decided to scrap the live audience for the debate due to coronavirus concerns. The debate will now take place at CNN studio in Washington out of an abundance of caution and in order to reduce cross-country travel, the DNC said. Okay. All right, so Dr. Anthony Fauci, who is the director of the National Institute of Allergy and Infectious Diseases and a member of the White House Coronavirus Task Force, did not mince words during an appearance on Tuesday night on Sean Hannity's show, Hannity on Fox News. Okay, and he gave a stark and sobering testimony before the House Oversight Committee to lawmakers the following day on Wednesday, contradicting several White House talking points. Host Sean Hannity, who has downplayed the seriousness of the virus and blamed those highlighting its severity as attempting to crush Donald Trump's re-election efforts, was dealt some harsh facts by Dr. Anthony Fauci during their interview. So Sean Hannity says, so this virus is impacting people with compromised immune systems, underlying other medical conditions, and the most vulnerable. What about the other 99%? If people got the virus, worst case scenario, how dangerous is it to them? Compared maybe to the regular virus, regular flu, he said. Now, though 80% of people infected would get sick but recover, about 15% would experience a significantly higher mortality rate, Dr. Anthony Fauci said, citing data from China and South Korea. He went on to say, quote, but Sean, to make sure, and let's see here, this is freezing up on me. He went on to say, but Sean, to make sure your viewers get an accurate idea about what goes on, you mentioned seasonal flu. The mortality for seasonal flu or mortality rate is 0.1% or 1/10 of 1%, 0.1% or 1/10 of 1%. The mortality rate for this is about 2 to 2.5%. It's probably lower than that. It's probably closer to 1%. But even if it's 1%, it's 10 times more lethal than the seasonal flu. You've got to make sure that people understand that. So it's at least 10 times as lethal as the seasonal flu. Now, when he says 2 to 2.5%, I'm not sure if he's speaking of globally or in the U.S. because we know, like last week, the World Health Organization was reporting like 3.4% mortality rate. But as more testing is done, if it's done earlier, you can head off the severity of the coronavirus. Okay, so which can reduce the mortality rate. Dr. Anthony Fauci reiterated this information Wednesday before House lawmakers in response to a question from Representative Michael Cloud, Republican from Texas. The congressman asked Anthony Fauci to compare COVID-19 to other infectious disease outbreaks such as SARS and H1N1 influenza, also known as swine flu, suggesting that it was important to find a balance between a proactive response and instigating overreaction. Okay. Now, Dr. Anthony Fauci explained that SARS, also a strain of coronavirus, infected about 8,000 people and killed 775 people over the course of roughly a year. Infected 8,000 people and killed 775 over the course of roughly a year. He said, quote, in the 2.5 months that we have had the coronavirus, as you know, we now have multiples of that. So it clearly is not as lethal, but it clearly spreads better. Now, the latest World Health Organization data states that there are more than 118,000 confirmed cases of coronavirus, and that's probably updated by now to probably about something like 130,000, somewhere around there, and 4,292 deaths since the virus strain was reported in late 2019. Factoring for the cases that are minimally symptomatic or asymptomatic, Dr. Anthony Fauci estimated the mortality rate for COVID-19 to be 1%, which means it's 10 times more lethal than the seasonal flu, he said. Okay. Representative Michael Cloud, Republican from Texas, asked, but less lethal than N1H1. He said no. Dr. Anthony Fauci said no, absolutely not. The 2009 pandemic of H1N1 was even less lethal than the regular seasonal flu. So Donald Trump also has tried to draw comparisons between COVID-19 and the seasonal flu in an attempt to soften the death toll from the novel coronavirus, tweeting this week that thousands die of influenza each year, while only 22 have died from the current outbreak. As of Wednesday, the U.S. has had more than 1,200 confirmed cases. And I'm telling you, as these test kits hit the health facilities, people going to get tested, confirmed cases are going to skyrocket. And you've had at least 37 reported deaths, more than double the number of confirmed cases since Trump tweeted this. Now, experts have reiterated that it is unwise to make comparisons between two viruses, and that although they may present similar symptoms in milder cases, the novel coronavirus does not have a treatment or vaccine. The novel coronavirus does not have a treatment or vaccine. Last week, Dr. Anthony Fauci made headlines when he corrected Trump's claim that a vaccine could be ready in mere months, advising Trump that it will likely take at least a year to 18 months. He again delivered information contrary to Trump's talking points Wednesday, urging, quote, aggressive containment and mitigation. This is what Tom Bossert, who was the former head of Homeland Security, said in his op-ed for the Washington Post Monday, March 9th. Dr. Anthony Fauci is urging aggressive containment and mitigation. Donald Trump has repeatedly praised his administration's response and underplayed the dangerousness of the outbreak. Okay, so this is a really good article from Huffington Post. Top disease expert repeatedly checks people comparing coronavirus to the flu. All right. So let me look at this here, and this is freezing up on me, so just bear with me here. I may have to pull this up on a second laptop. I want to go to the okay, so let me just get these updates, these breaking news stories. Okay, so National Hockey League suspends season as coronavirus continues to shutter North American sports. That just in from the Washington Post. The National Hockey League announced its decision Thursday afternoon following previous moves from National Basketball Association, NBA, Major League Soccer, and a host of international leagues and tours. The NBA on Wednesday suspended its season indefinitely after a player tested positive. Okay, so we know that. All right, so here you have National Hockey League as well. So all that's going to have a ripple effect throughout the economy. Concession stands, taxis, Uber rides, restaurants that depend on the traffic coming from the games. Okay, then the radio stations, the TV stations that run ads promoting the games, etc., things like this. Okay, that has a ripple effect. Let me pull up the article from Detroit Free Press here. Okay, because they had some good information dealing with protecting against the coronavirus. How to stop the spread of COVID-19 in how to stop the spread of COVID-19 in Michigan, but this applies across the country. Okay, so while that loads up, let me look here, and this computer's freezing up. So let's look at the second computer. Okay, Black History 24/7 in Chicago. How you doing? Let's see, Tracy is going to cover the states. Yep, he's going to hit all 50 states. Wayne, the pot calling the kettle black. How many of these reports, media articles, do you believe are true and not biased? Well, you can read them yourself. That's why I'm giving you the articles, Wayne Barboza. If you really want to be funny about it, you can read them yourself. Why don't you go check your boy Trump? He's the one that's been lying to you. And even Mike Pence had to come out and contradict Trump. So, you know, you must be coming in late or something. I don't know what your problem is, but you can go read this stuff yourself. Just the fact that the White House had to contradict the statements that Trump made last night should tell you how incompetent Trump is, but you probably voted for him. Okay, this administration is from the devil. They attacked the CDC pandemic response team. Yep, a long time ago for a reason. Yeah, so you've heard me talk about this before, right? October 2019, Trump administration shut down the Predict project, and Predict was a project that was used during the Trump administration, not the Trump administration, the George W. Bush administration and the Obama administration. And it was a project to monitor these pandemics so you could get ahead of it. I'll give you the name of that article because that was shut down in October 2019. And this is an example of what happens when you don't understand science. And you think you know more than the scientists. That one's from Vox.com. I thought it was the last page here of these notes. Okay, but it's not. But I'll give that to you. So I want to make sure you read that. Okay, we'll pull that one up. I got about 25 pages of notes here for my for the show I did this past Sunday. Okay, I'll pull it up on the other laptop here. That one, oh yeah, I already have it up here on the second laptop. This is from Vox.com, October 29, 2019. A crucial federal program tracking dangerous diseases is shutting down. A crucial federal program tracking dangerous diseases is shutting down. Predict, a pandemic preparedness program, thrived under President George W. Bush and President Barack Obama. Now it's canceled. This is from October 29, 2019. Most of the deadliest diseases to affect humanity leap to human hosts from other animals. The 1918 flu pandemic, which people need to study, because this I've read about it. I've read a number of articles dealing with the 1918 flu pandemic, how President Woodrow Wilson tried to cover up the severity of it in this country. The same thing that happened in 1918 is taking place right now. The White House was basically lying to the people about what was taking place. They were trying to cover up the severity of it. And President Woodrow Wilson ended up getting the Spanish flu also. So the 1918 flu pandemic likely came from birds. HIV likely jumped from a similar virus in chimpanzees and other monkeys. Recent Ebola outbreaks have come from bats, rats, and gorillas. Ever since the 2005 H5N1 bird flu scare, the U.S. Agency for International Development, USAID, has run a project to track and research these diseases called PREDICT, P-R-E-D-I-C-T, PREDICT, at a cost of $207 million during its existence. The program has collected more than 100,000 samples and found nearly 1,000 novel viruses, including a new Ebola virus. But on Friday, the New York Times reported, now this is from October 2019. So Friday, October 2019, New York Times reported that the U.S. government is shutting down the program. According to its former director, Dennis Carroll, the program enjoyed enthusiastic support under George W. Bush and President Barack Obama. But, quote, things got complicated, end quote, in the last few years until the program essentially collapsed. Some aspects of the program, it's unclear which, will be continued under different auspices in other departments of the government, but the core program, working with local researchers around the world to collect samples and better understand viruses in animals, is over. So read this full article because it goes through and explains PREDICT. Trump shutting this program down has severely hampered their ability to get ahead of the coronavirus. This stuff didn't have to happen. Okay, all right. So let's look at the article from freak.com. I think we pulled that up here because my main computer froze up on me. All right, so coronavirus in Michigan, how to stay safe and stop the spread of the virus. As the global coronavirus outbreak worsens, here's what Michiganders need to know about COVID-19 with steps to prepare to stop the virus spread. Okay, and a lot of this applies across the country, so that's why I'm sharing it with you. This is from March 11th, 2020. So here's what to know. According to the U.S. Center for Disease Control and Prevention, coronaviruses are a group of viruses that can infect humans and animals. Their name comes from crown-like spikes on their surface when you look at them under a microscope. These viruses can cause a common cold or a more serious disease, including Middle East Respiratory Syndrome, MERS, Severe Acute Respiratory Syndrome, SARS, and Coronavirus Disease 2019. I washed my hands before we started, just so you know. Okay, I did. I washed my hands before I started this broadcast. You see me touching my face. Now, COVID-19 is the disease caused by the virus named SARS, CoV-2. COVID-19 is the disease caused by the virus named SARS-CoV-2. It first appeared in Wuhan, China in late 2019. Okay, symptoms usually occur within 2 to 14 days of exposure and include fever, cough, and shortness of breath. More serious symptoms can occur usually when people have other medical conditions, including pneumonia. So underlying conditions, you can have a compromised immune system. Diabetes can cause you to have a compromised immune system as well. All right, and let's look at this here on the second computer. So now what happens is you can be asymptomatic. You can have it for 2 to 14 days before you have visible symptoms, but you're still contagious. And this is the dangerous period. So what is an epidemic? An epidemic is the rapid spread of an illness affecting a defined region or population. That's an epidemic. What is a pandemic? Because the World Health Organization just declared this a global pandemic. A pandemic is a global outbreak of a serious new illness that requires sustained transmission throughout the world. Sustained transmission throughout the world. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, told USA Today in February. That's a variation of the World Health Organization's definition. They define a pandemic as the worldwide spread of a new disease. Usually they look at it hitting different continents, spreading from human to human throughout different continents. So the World Health Organization on Wednesday, March 11th, declared COVID-19 as a pandemic. Okay. All right, everybody, share this broadcast on your Facebook page. Invite your friends to tune in also. Let's go to some more of your comments here. And then African American business owners, post the name of your business here on the thread of the broadcast. Email us at customerservice@africanhistorynetwork.com. Customerservice@africanhistorynetwork.com. We'll let you know how you can advertise with the African History Network as well. Current promotion, buy 1 month, get 2 months free. All right. Let me see who we have here. We've got Aaron, Tracy, okay. Older newborns is easy. Yeah, it's so older people. Now for younger people now newborns will probably newborns usually have a weaker immune system. Younger people tend to be more resilient. It has less of impact on them. Older people, just like the CDC, BusinessInsider.com had an article where the CDC is advising people 60 years old or older not to go outside unless they have to go get medicine, things like this. Is advising them to stock up on food, stock up on medicine, don't go outside unless they have to get medicine, etc. This is for people 60 years old or older. They also are advising that people like 60 years old or older don't fly on planes, especially for extended periods of time, and don't go on cruises. All right. So yeah, those who are older, it hits them more, especially if they have underlying causes, heart disease, immune deficiencies, etc. Okay, we got Shago, Owen, Alicia, this will be the people watching, SB. Okay, so share this broadcast. All right, let's continue. Let's go back to this. This is from Detroit Free Press, freep.com, F-R-E-E-P, freep.com. All right, so symptoms. COVID-19 symptoms are fever, cough, and shortness of breath, according to the CDC. Symptoms typically appear in as few as 2 days after exposure or as long as 14 days after exposure. The World Health Organization has reported that COVID-19 patients have also complained of fatigue, aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. Some symptoms can range from mild to severe. Some people who are infected do not develop any symptoms. Some people who are infected do not develop any symptoms. About 1 in 6 people with COVID-19 become seriously ill and have difficulty breathing, according to the World Health Organization. Okay, so there's no need to panic, but there is a need to take precautions. There's not a need to panic, but there is a need to take precautions. And then if you're older, you have to take more precautions and be more careful. About 80% of people with COVID-19 recover without special treatment. All right. Now, I'm going to post the link here because they have a chart here. They break down common symptoms, mild breathing difficulties at the outset. They break this down. So after 2 to 7 days, you may develop a dry cough, mild breathing difficulties at the outset, gastrointestinal issues, diarrhea, general body aches, severe symptoms, high fever, 100.4 degrees Fahrenheit or higher, pneumonia, kidney failure, death. Transmission, cough or sneezes from infected person or touching contaminated objects. Okay, let me post this because we'll get into prevention here in just a second. And they're advising people, if you cough or sneeze, do it into the crook of your elbow or into tissue, not just with your hand, but also seen them advising tissue. Okay, do it like that as well. All right, now let's go back here. So prevention. Health officials recommend all Americans take these steps to prevent the spread of COVID-19 and other infectious diseases. Wash your hands or use an alcohol-based hand sanitizer when soap and water are not available. Avoid close contact with anyone who is coughing or sneezing. Avoid touching your face. Avoid touching your eyes, nose, and mouth with unwashed hands. Okay, so no more handshaking. You know, if you're in a fraternity, you can't give your brothers the grip. Okay, you got to either do elbows or do an air high five or something like that. Okay. Cover your mouth and nose with your arm or a tissue when you cough or sneeze. Avoid shaking hands, elbow bump instead. Stay home if you are sick. Stay home if you are sick. Don't listen to dumbass Donald Trump on Fox News. Stay home if you are sick. We already know, okay? If you have the flu and you are at work with the flu, your manager, supervisor, what have you, your coworker is going to tell you, get the hell out of here, go home. That's the flu. COVID-19 is more contagious than the flu. And it's at least 10 times as deadly. So you don't go to the flu if it's you don't go to work with the flu. Most people know that. Okay? The same thing applies to this. Stay home if you are sick. Clean and disinfect frequently touched objects and surfaces. Washing your hands, you're likely doing it wrong. So they show how to wash hands. They say do it for at least 20 seconds. And post a link here. You can read this full thing. I'm just fast forwarding through some of this here. Oh yeah, they break it down. Get in between the fingers, all that stuff. Rub palms together with fingers interlaced. Scrub the backs of fingers and fingernails and cup palms with fingers tucked together. Most people are washing their hands incorrectly. Okay, they go through and graphically show you how to wash your hands. All right. Now, Donald Trump has not been tested for the coronavirus yet. As of this morning, he has not been tested because he has come in contact with people like Representative Matt Gaetz, who was flying on Air Force One. And these people came in contact with someone who was diagnosed with the coronavirus. They came in contact with that person at the CPAC conference. And Donald Trump said, oh, no, I feel fine. I checked with my doctor. It says no need for me to get tested. So you don't care about your wife? Because you can be infecting your wife. You don't care about your children? You don't care about your staff? You can be infecting them. You can have it and not have symptoms for between 2 to 14 days once you are infected, but you can be infecting other people. This is the President of the United States. At-risk populations. Seniors and people with underlying health conditions such as lung disease, diabetes, asthma, heart disease, or a weakened immune system are at highest risk of COVID-19 complications. In addition to following general recommendations, they also should avoid crowds, such as at sporting events, rallies, concerts, and large community gatherings, where they could be where there could be people who are carrying the virus. People who are most vulnerable for having serious complications from COVID-19 also should consider checking their supply of medication to ensure that they have enough in the event they are sickened by the virus, the CDC advises. Quarantine, okay? So you hear about self-quarantining. Quarantine occurs when a person is believed to have been exposed to a disease but is not symptomatic, according to the CDC. It is a way to monitor if symptoms develop and at the same time avoid any possible spread to others. People under quarantine for possible COVID-19 might be asked to stay home and avoid going out in public for a period of 14 days. Isolation. Isolation occurs when a person is known or believed to be infected with a disease that is potentially transmittable, according to the CDC. It's the process of separating known sick people from those who are known to not be sick. An isolated person is usually told to stay in a separate room from other people in their homes and use a separate bathroom. That's isolation. Now, isolation for public health purposes may be voluntary or compelled by federal, state, or local public health order. The CDC says. Social distancing. So we hear about social distancing. The CDC defines social distancing as remaining out of congregate settings, avoiding mass gatherings, and maintaining a distance approximately 6 feet from others when possible. So a lot of people ask about a face mask, and there's been a run on face masks. They're hard to find them. Okay, everybody doesn't need a face mask. It makes it harder for the health professionals who do need one, because everybody else is getting it. A lot of these other people are buying face masks. The Center for Disease Control and Prevention does not recommend face masks for healthy people to protect from respiratory diseases, including COVID-19. Rather, the agency says face masks should be worn by healthcare workers as well as people who are sick and show symptoms of COVID-19 to avoid spreading it to others. Who to call for help? Okay, don't call Ghostbusters. All right. If you suspect you may have novel coronavirus, call your doctor or local health department and ask about what your next steps should be. Don't just go to the hospital, because then that causes a log jam at the hospitals. Okay, so call and they will direct you on what to do. Do not visit the office of a healthcare provider without calling ahead first. Find contacts for your local health department here. Okay, so they give them, I think this is from Michigan, malph.org. It's probably from Michigan. But for whatever state you're in, probably if you go to your Secretary of State's website, they probably have information there of who to call. Okay, and then they have websites for the Center for Disease Control, that's cdc.gov, World Health Organization, etc. All right, so we posted this link here. We'll post it again. It has some really, really good information. I think 99.9% of people in this country are washing their hands incorrectly. Personally, I wonder if Donald Trump washes his hands when he. I heard he's a germaphobe, but you would think that he would get tested for the coronavirus if he is a germaphobe. All right. Okay, so let's post that here again. That's from Detroit Free Press and CDC, Center for Disease Control. Okay, so since the rest of that froze up, okay, he's a narcissist. He don't care about anybody but himself, Cherie said. Yep. I agree with that. You would think, trying to be a responsible father, trying to set a good example for the rest of the country, because he had contact with people who had contact with someone who was diagnosed, you would think he would set an example and get tested, you know, to err on the side of caution, things like this, protect his wife. But no, okay, all right, whatever. Chickens are coming home to roost right now. Okay, well, look, hey, we have a couple new advertisers here. Black Heroes of Fire. Black Heroes of Fire. The history of the first African American fire company in Chicago is a fantastic book written by DeKalb Walcott Jr. Black Heroes of Fire introduces and describes the background of the members of Engine Number 21, Chicago's first organized paid African American firefighting company. Find out about the history of Engine Number 21 in the book Black Heroes of Fire by DeKalb Walcott Jr. It's available at Amazon.com and also the website blackheroesoffire.com. Blackheroesoffire.com. Okay, well, people who are still traveling, you may not fly, but you may drive. Because a lot of people are driving now because there's less exposure if you have to travel. BlackLionLeather.com has cultural accessories for African Americans. They allow you to carry your culture. BlackLionLeather.com is a unique travel accessory brand. They manufacture and sell online to the culturally inspired African American traveler. They are 100% African American owned and operated. Their tagline is carry your culture, carry your culture. Now, a lot of people are interested in health products, especially now with what's going on across the country. Sage and Elm Apothecary takes a holistic approach to self-care, to self-care products. Sage and Elm Apothecary designs over 60 different beautiful handcrafted soaps, natural toothpaste, hydrating oils, deodorant, face masks, shampoos, conditioners, and so much more. They extend. You can find Sage and Elm Apothecary online at sageandelmapothecary.com. Sageandelmapothecary.com. APOTHECARY. You can find out about their pop-up shops, their vending events throughout this year to make your purchases as well. Visit their website, sageandelmapothecary.com. They have a special discount, 20% off a spring sale. Use the code AHNSPRING20. AHNSPRING20. Let them know you found out about this from the African History Network. All right, look, hey, we're going to get out of here. So everybody follow us on our Facebook fan page, The African History Network. Turn on notifications so you know when I go live. Then also sign up for our email newsletter. Text the word KEMET, KEMET, the 22828 to sign up for our email newsletter. Text the word KEMET, KEMET, the 22828 to sign up for our email newsletter. And follow us on our YouTube channel, Michael Imhotep, IMHOTEP. Turn on notifications there so you know when I go live. We broadcast our Sunday night show, the African History Network show, which I've been doing for 10 years. 4 years on 9:10 a.m. at Superstation, so I'll be in the studio this Sunday. We're on Sundays, 9 p.m. to 11 p.m. Eastern Standard Time, the African History Network show, so look out for that as well. All right, you can order all my DVD lectures at our website, AfricanHistoryNetwork.com, AfricanHistoryNetwork.com. We have bundle packs there, and we still have the 15 DVD bundle pack, the Black History Month bundle pack also at AfricanHistoryNetwork.com, right on the homepage. All right, look, hey, we have to get out of here. Remember, at the African History Network, we focus on educating, empowering, and inspiring people of African descent throughout the diaspora and around the world, because right now it's correct wrong behavior. It's not over till we win. Wakanda forever. We'll talk to you next time. Peace. Stay safe.